You are listening to Inspired Caring, episode number 158. Hello, welcome to Inspired Caring. I'm your host, Michelle Magner. If you are caring for an older family member, this is the podcast for you. Each week, I bring insight, tips, inspiration, and strategies to help you care for the people that you love without losing yourself along the way. Having cared for both of my grandmothers, I've helped manage everything from hospital stays, households full of belongings, to navigating senior living and end-of-life care. And I've worked in senior living as a result of that experience, serving my residents and their families as they've been on this journey too. Thank you for joining me today, and I hope you enjoy this episode of Inspired Caring. I'm very pleased to welcome Nicole Broadhurst with Tennessee Health Advocates today. Nicole is a board certified patient advocate. And so I know so many of us are caring for a parent, aging family member, and the medical system is like super freaking confusing and complicated. And we need help understanding how to navigate. There's just like a big insurance piece of it and the medical financial piece of it. And so I'm excited you're here.
Thank you, Michelle. I'm super excited to be here. It's always a blast to hang out with you. So I'm really excited for that.
Share with us a little bit just about like broad strokes, your company and what it is that you all do.
I actually spent almost 30 years as a healthcare administrator. And I know, right? So my favorite part of that work, I learned that my favorite part of that work was when patients and families would stop in my office with these pieces of paper and say, I got this in the mail and I don't know what it means. Can you help me? And I loved sitting down with them and going through the pieces of paper and helping them not be scared, because even though a piece of paper says this is not a bill, it still feels really scary when we read that, right? I know,
Yeah,
I'm
there's
always like,
numbers on it.
it looks like a bill.
It looks like a
I don't
bill.
know, it looks like a bill. And we all grew up with this, if it looks like a duck and walks like a duck, it's probably a duck.
Yeah.
And those things kind of look like bills. So I love that part of my job. And when I left my corporate role in healthcare administration, I really wanted to spend more time in that area of helping patients and families. So I created Tennessee Health Advocates. I became board certified and I transitioned my skill set in the healthcare revenue cycle and transitioned that into really educating patients and families on everything on the financial realm, understanding benefits, understanding bills, explanation of benefits, um, all of the things that go along with the financial aspect of healthcare. And boy, am I having a good time doing it.
Oh my
Like
God, that
we
makes me
do,
so
yeah.
happy that you're happy doing that.
Hear that a lot. So if you don't like spreadsheets, I love them.
Oh,
I love them. I was just talking to a client about that, and I said, I have this spreadsheet that's like incredibly complex, multiple sheets, multiple formulas. It pulls everything together. It's linked to all of the supporting documents. And my clients generally say, I'm glad you like that, Nicole.
I'm so grateful and happy and excited for you.
Yeah. So to sum it all up, I have a done for you service where literally my clients can upload an email or snail mail me all of the pieces of paper that come to them about their healthcare finances, bills, EOBs. I do all of the work. I cross-reference, I audit, I negotiate if it's necessary, I'll appeal things. I do all of the things that just don't that take too much time and energy
Right. Or
to do in a
like,
regular, yeah.
yeah, or it feels like you need a degree in something to be able to sort it out, or the fact that you have that whole background, years and years on the other side of that door. You really know the ins and outs and nuances of how the billing system works.
Exactly. Yeah.
Yeah.
Yeah. So,
So who is like an ideal client for you? So if you
mhm.
are like, if I showed up with 2 years of explanations of benefits and bills that I've paid, like that just would make me dizzy. That would excite you, or
Yes, that would really excite me. So I have all of the time. I was just talking to a woman, she's out in Seattle, and she has had a significant medical event. It was unexpected, and so it's not something that's been ongoing, but it's been going on for about a year and a half to 2 years. So she has literally a shoebox of paper. Now I'm grateful because she actually kept them. So that's a good thing, right? We have access to them. Sometimes we don't because sometimes, sometimes patient papers get lost and misplaced and that type of thing. I can go through and organize and get those squared away pretty easily. Even if you don't have them, in today's world, we have member portals where we can pull electronic documents.
Mhm.
So there's lots of ways for us to attack that. But I absolutely, like I said, I have a spreadsheet that I create and cross-reference everything. My clients typically send things to me. I do a quick review and an audit, and then I will say, yes, this one's okay. It's processed correctly. You can confidently make payment on this bill. Or I'll say, something's not quite right on this one.
Mhm.
I'm going to go ahead and call the doctor's office, or I'm going to call the insurance, and we'll get this worked out and kind of put it on hold. The bottom line is this: it removes that entire piece of
Mm.
what's happening medically. And this kind of goes back to my original why I wanted to do this. It is painful for me to see patients and families who are already battling some sort of medical issue,
Mhm.
diagnosis, treatment plans, specialists appointments, testing, diagnostic, all of the stress that happens just innately with the medical issues.
Mhm.
I just feel like it is really wrong to also saddle them with the stress of the financial piece.
Right.
And if there's something that I can do to remove that, actually, you know what it's like when you have financial stress, it causes physical problems, right? So it feels like it's compounding things as opposed to helping somebody get healthy. So my mission is to bring some relief to that for
Mhm.
patients, family caregivers, anyone who's involved with the whole process, is to remove that financial stress from the equation so that they can have confidence and feel comfortable knowing that they can focus where their efforts really need to be, which is getting better, taking care of mom, helping your sister, whatever that is in regards to the medical issues.
You're so right. That added stress can create its own manifestations of physical and mental health ailments, as we're trying to navigate all of this. And I don't even understand what my insurance policy will really cover. And I think that is, I'm understanding like that's part of what you
Yeah.
help fine tooth comb pick out for people.
Absolutely. In fact, one of my most common services is helping people understand their benefits. In fact, I have a whole presentation that I do on the top 3 financial risks that every patient faces. And the number one risk is not understanding your benefits. Because
Yeah.
if you don't understand the benefits, chances are you're not going to understand what your financial responsibilities are either. Then when the bill comes, it may be right, but you didn't expect it. And that can be really, really painful. So yes, reviewing your policy,
Mhm.
making sure that you understand those benefits. And if you have questions, just know that there are people out here that can give you the help and support that you need.
And so often it feels like what we are and are not receiving as treatments are based on what is being covered in those policies. And so, can you help? Like, do you help people flush out other options or directions of care or finding other resources to cover treatments too?
So I don't get into the clinical aspects of the treatment plans. However, there are advocates who do that. So I just want to be clear that you can get general information about advocacy as a bigger umbrella. You can
Hmm.
check that. I would suggest checking out GNAnow.org. It's GNAnow.org. It stands for Greater National Advocates. It's a free directory for advocates who help in all different specialties of healthcare. My specialty is just the finance part. So what I can answer about that though is that in my work that I do, I will help make sure that we can get treatment covered. Here's my big message. Insurance is a contractual agreement between the insurance company and the providers, as well as the insurance company and the member or patient, right?
Hmm.
And the policy itself contains all kinds of information. And so if we are having a certain treatment done, there are things that we can do to make sure that we're meeting the criteria to access the benefit. It's a whole lot of words, right?
Hmm.
To say that really we can dig into the specifics of the policy and make sure that the doctor knows. I just did this last week. I created a checklist. I had a client whose physician was trying to get, or is currently trying to get, the placement of a spinal cord stimulator in being placed in my client. Now, I'm going to tell you, I don't know anything about clinical. Like that's not
Sure.
my thing. However, what I do know is that the Empire Blue Cross Blue Shield policy that my client has a clinical policy that outlines very specifically what needs to happen in order to get a spinal cord stimulator approved. So what I did was I pulled the information and I created a checklist for the physician so that my client had a very clear checklist to give to his doctor. This doctor could go through the medical records and go through point by point and make sure that everything was in line so that in the event insurance denied the claim, we have grounds for an appeal
Yes.
where we can very specifically say, we met the criteria. We did exactly what you said needed to be done. This needs to be overturned and the benefit needs to be paid. So
That's
that's just an
amazing.
example.
Yeah. So instead of being in this space of reactive, where we have our shoebox or our bulging files full of paperwork, you are able to help people on a proactive approach.
Yes.
Once they have a diagnosis or a procedure is being discussed, then you're able to cross reference all that data that feels very confusing and really document what people need to do to get the coverage.
That's correct. We get access to those benefits. Yeah, and if we step back one step even further than that, if somebody, the other thing that we can do is we can get some real clarity on when we have different plans that we're choosing, if we have options. So a lot of times in open enrollment, you get 3 or 4 options from your employer. We can also help you do some really, really good apples to apples comparison
Mhm.
and get a real straight and clear identification of what you need to know so that you can choose the plan that's going to best meet your needs. Because every plan doesn't meet every person's needs. And there's not always a real clear comparison. Sometimes the information we're given feels like we're looking at an apple and an orange, not
Mhm.
necessarily 2 apples, right? Um, so that's something else that we can help do over there.
I love that. So even for our own self, you would be great to have on deck before or at that time.
Yeah. Yeah, I get really busy during open enrollment. I have a special product for open enrollment that consists of, you provide me all of the open enrollment information. I literally create an apples to apples comparison document and then give that to you. You have time to review it, and then you get a Q&A session with me afterwards. So
Mm.
that once you have the opportunity to compare them, You can come back and you get time with me to ask those questions and make sure that what you see is what you understand so that you can make that choice knowing that going into the next year, you've got the coverage that makes the most sense for you and your family.
Right. When would be another time for someone to reach out to you? So we've talked about like retroactively after some stuff's gone down. Open enrollment's a good time. What about time like a time of diagnosis?
Yes. If you've got a new diagnosis and you are looking at new physicians, you might want to have a network check done. Anything that truly I'm going to encourage anyone to reach out for a help anytime they're uncomfortable.
Okay.
And the reason is this. Sometimes I can get the answers to you in a simple phone call. I took a phone call from a gentleman last night. He was renewing his mother's Medicaid. She's in a facility and she's got Medicare, and Medicaid is secondary. And, you know, all of the renewals have started happening since the public health emergency is over. And so he's very nervous, right? This is the first time he's had to do it. He's got a
Mhm.
lot of information that he needs to share. And he just had some questions about, okay, when I transfer this money out of mom's account, how do I report it on the forms? Truth is, we were able to get through that in about 25 minutes. And there was no, like, we didn't engage. There was no payment. He didn't become a client. He just had some questions that I could answer in a phone call. And so that makes me feel really good to be
Mhm.
able to answer those questions, because it's really about gaining that peace of mind and relieving the stress. That doesn't always mean you have to pay for anything. It could be that you just need to be reassured that you're headed in the right direction. So anytime you feel uncomfortable and you're just not sure, reach out. It's not going to cost anything for a phone call.
That's great. And I mean, even just what you have shared over our conversation, there are the benefits of reaching out to you also could mean treatment, like actual coverage of treatment that maybe you wouldn't have
Yes.
otherwise got because you didn't think that you qualified for it or you didn't take the necessary steps to get it covered. And then I imagine that you can also find like money saving opportunities within invoices and bills and things like that.
Yes.
Okay.
We generally, yeah. So that's a whole nother area where, this whole idea of shopping for healthcare is pretty new, right? Like, we've always wanted to be able to do that. And it's actually starting to come to fruition. And I say that because there are some pitfalls. There's some things that, we'll see improve over the next few years.
Mhm.
But for the first time ever, right? If we know what services we need, there's actually an opportunity for us to check and see, what's that going to cost me? What does that look like? How's that going to impact my pocketbook? Obviously, we are not talking about emergency services. Those, like, get those right away. Don't wait. Like,
Right.
just do what you need to do.
Right. Yeah, I always say I'm not a clinician. I can't diagnose or treat. Call your doctor. And you're saying, don't wait for us to have a phone call before you go to the hospital.
Right. I laugh, but it's not funny, right? I
Right.
literally had a gentleman. His child was in a window where they didn't have insurance, and his child got very sick. And literally he did call me from the car on his way to the emergency room with
Oh
his
my
son. And this was my message to him. Go take care of your son. I'm not afraid of whatever's going to happen. Take care of your son. When things start coming in, we will deal with them then.
God.
We're
Mhm.
not going to worry about that right now. I
Right.
mean, I literally was like almost in tears that, here's this parent who's taking their child to the emergency room and calling me. We don't have insurance. I'm scared. And I'm
Right.
like, don't be scared. I'm not scared. Get your son the treatment that he needs.
Mhm.
Um, yeah, it's really important, like, because it is scary. You're in an emergency and like, I don't know what's going to be covered. I say this a lot. There's not a medical bill out there that I'm afraid of.
Okay. That's good to
There's
know. Yeah.
there is not one I'm afraid of. It hasn't happened yet. I don't expect it to happen, and I've seen some pretty big ones. Um, so call whenever you feel uncomfortable.
Yeah. And that's such a great point, to your point, because so many of us who are helping aging parents also have either kids or grandkids that are in our care or world. And so this is an
Right.
important message for them to hear too.
Absolutely.
Yeah.
Absolutely.
Well, any parting thoughts or words, anything we didn't cover?
Well, I am going to say this. I have a free audit checklist. It's
Ooh,
the checklist that I use to audit my personal bills, medical bills, my husband's bills, my clients' bills, and it's available on my website,
yes.
which is TennesseeHealthAdvocates.com. So go get it. When you get that checklist, it also gets you into my monthly newsletter where I'm sending out ways to save on healthcare, things to be looking for. Just so that you're aware. I have a whole series right now on how to save money on your healthcare. It's like eight sessions long. It's great information. Everything from understanding your benefits all the way to financial assistance and how to apply for that. So
That's
check that
amazing.
out, get the audit checklist, and audit your medical bills.
I love that. Thank you. Thanks for sharing that gift with the
Yeah,
audience. That's wonderful.
absolutely.
Any other ways people can track you down?
LinkedIn is always, that's kind of where I live in social media. I have other accounts, but that's the one. So if you want to connect with me, Nicole Broadhurst on LinkedIn, I'd love to see you there.
Awesome. Thank you so much.
Yeah, thanks, Michelle.